All right, so now we're going to look at blood vessels, and we'll do a little bit of heart features as well by looking at cross-section views, specifically computerized tomography, MRI images. And so this is going to be a little challenging for you at first because you're going to have to train your brain to think in terms of cross-sections, whereas the viewpoint we've been using primarily previously in this unit are frontal views, where you're looking at an anterior view of the structures, but now you're going to be looking at a cross-section. So let's get you oriented first of all. This is a cross-sectional slice across the thorax. So the CT scan went across the chest. Here we're seeing the heart. So I'll put an H there for heart. All right, this would be the sternum or your breastbone. Just trying to show you some landmarks. So in other words, this person is laying on their back, which means that this is the anterior end of the body. And this is the posterior end. Note right here we've got the vertebra. This would be a thoracic vertebra. And then you need to know if you're looking top down or feet up. And it does happen to be feet up. So you're sitting at the foot or feet of this person, and imagine you've got x-ray vision and you're looking up through their body in this CT scan. Now, why is that important? That's important because that means this side of the body is the right side, and this side of the body is the left. And that's important because that's consistent with any other frontal diagram you've looked at. We wouldn't want to mix up our right and left, especially if we're about to perform surgery or something like that. So now that you're oriented, let's go ahead and look at some cross-section images. I would recommend that you print out these cross-sections. You've got an entire file of all the cross-sections that we'll be covering this whole semester. And we will come back to some of the same cross-sections and look at other system organs, like digestive organs, etc. So it might be handy to have one set of printouts that you could continue adding notes to. All right, so here we're looking at what we call section 8, and we would be right around the neck. For example, this right here is a cervical vertebra, so I'll put C for cervical. And these sections go in order about an inch apart. The section 1 in the packet that you have, if you want to print it out, kind of goes right through the forehead, and then they just go inch by inch all the way down to the body. We go all the way down to the pelvis. So the last section we'll look at in a minute is down in the pelvis. All right, so for now we're going to focus on looking at arteries and veins and some heart features. Now, you got to kind of train your eye when you're looking at CT scans. The patient was given a contrast medium. They ingested a fluid, in other words. And so any liquidy areas of their body will fluoresce a bright white. Any air-filled areas will remain black. So for looking for blood vessels, you want to look for the color white because that fluid will fluoresce a bright white in a CT scan. All right, so we're going to find the common carotid artery, which lies right next to the internal jugular vein. Now, keep in mind, arteries come away from the heart. They're under high pressure, so they tend to be a narrower diameter. Veins are low pressure and are returning to the heart, but of course what goes into the heart must equal what comes out. So the way veins keep up with arteries is by being a larger diameter. Since they have lower pressure, they make up for it by having a larger diameter to carry a larger volume of blood. And that way, what goes into the heart by way of veins can keep up with what comes out of the heart. So why did I say all that? Well, when you're looking at a cross-section, a smaller structure, a circular structure, is likely to be an artery, and a larger diameter structure is likely to be a vein. So I've just highlighted the common carotid artery there in green. And then its paired vein right next door is the internal jugular vein, which you'll note is a larger diameter. All right, now here we're below the neck and we're officially in the thorax and the chest. So we're kind of in the upper chest. And we're right above the aortic arch. So what we're seeing here are the lungs. So this would be one lung, this would be the other lung. Suppose I should be careful. Right lung and left lung. Just for your reference, this would be the trachea that you breathe through, air pipe. And then these white vessels would be the 3 branches off of the aorta, or aortic arch. So we've got 1, 2, and 3. So let me highlight those. The first branch off the aortic arch is the brachiocephalic artery. The second branch off the aortic arch, as you know, is the left common carotid. And the third branch off the aortic arch is the left subclavian artery. All right, now we're below where we were just at, section 11. So now we're actually at the aortic arch. So here's the superior vena cava, which is feeding into the heart below. And right next door, stretching across, that would be the aortic arch. You'll note you can still see the lungs here. So this would be the right lung, and this would be the left lung. All right, for section 12 here. Now we're getting really close to the heart itself, and we're seeing all the major vessels at the base of the heart. Remember that wide upper part of the heart where all the vessels come out is the base. So here we've got the superior vena cava. It's still in the same spot as it was in the previous image. Right next to it is the ascending aorta. Right next to that is the pulmonary trunk. Remember that artery that leads to the lungs. Speaking of leading to the lungs, the pulmonary trunk, divides into the right and left pulmonary arteries. So this would be the right pulmonary artery, and this would be the left pulmonary artery. And then behind the heart, of course, behind the arch, is the descending aorta. A really good landmark for finding the descending aorta is the body of the vertebra. In this case, it's a thoracic vertebra. So I'll put, BV for body of vertebra. That's a really handy landmark. If you can find the body of the vertebra, which the vertebrae and all bones are bright white in a CT scan, and then look right next to the body of the vertebra, you'll very reliably find the descending aorta. And remember, the descending aorta goes all the way down through the thorax and all the way down through the abdomen. So you're going to see it on many of the next several slides. All right, here on section 13, it's quite noticeable. That whole thing is the heart. You can almost make out the chambers. So this would be one of the ventricles, the right ventricle. This would be the left ventricle. And up here would be the atria. So that would be the right atrium and the left atrium. Remember, this person is lying on their back. Right over here is the sternum, you'll recall. All right, and then remember the way to find the descending aorta is find the body of the vertebra, and it'll be right next door to it. All right, this image looks very similar. We've just sliced another inch or so down. We're still seeing the heart, and we're seeing the descending aorta. Okay, so now we're down in the abdomen, and we're seeing this whole big thing here is the liver. And so we can still see our descending aorta. And then right next to the liver is the inferior vena cava. Remember, the hepatic veins drain into the inferior vena cava, so the IVC runs right next to the liver. So it makes sense that it would be located right next to the liver. All right, so now we've gone a little bit further. We could still see the liver here, so that's the liver. Just for reference, here's the stomach. Here's the spleen. All right, here's a kidney. Just trying to give you some reference points. Here's our vertebra. So right next to the vertebra, of course, is the descending aorta. Coming right off the descending aorta, you can actually see it branching off, is the celiac trunk. And then coming off the celiac trunk, that's the inferior vena cava. And then coming off the celiac trunk is the splenic artery. And right next door to the splenic artery, remember arteries and veins run in parallel? Right next to that is the splenic vein. All right, in this image, we can definitely see the kidneys really well here. So that would be the right kidney, and that would be the left kidney. And here you can see the body of a lumbar vertebra. So that's the vertebra. All right, so in this image, what I want you to note are the renal veins. You can see them kind of connecting to the kidneys. And the renal veins, after they drain the kidneys, they dump right directly into the IVC. And you'll notice in all of these slides, the IVC has been in the same location each time. It basically runs straight up and down through your abdomen. All right, and finally, our last section, we've actually moved quite farther down into the body. What we're seeing here, this is the pubic symphysis, right in your pubic area. If I can get this to work. There we go. I'll try to put a P. Pubic symphysis. All right, just for reference. And here we're seeing the two major vessels leading down to the thigh. So the smaller one, of course, would be the artery, and then the larger one is the vein. And because we're heading to the thigh, we use the word femoral, meaning thigh. All right, that is it for your CT sections for this unit anyways.